Welcome back to our Doc AI channel. Today, we're going to discuss a topic that affects millions of people worldwide: asthma. Whether you or someone you know has asthma, or you simply want to learn more about this condition, you've come to the right place. In this video, we'll explore the causes, symptoms, and management techniques for asthma. So, let's dive in. Part 1. What is asthma? To begin, let's understand what asthma actually is. Asthma is a chronic respiratory condition that affects the airways, the tubes that carry air in and out of the lungs. When a person with asthma is exposed to certain triggers, their airways become inflamed, narrowed, and produce excess mucus. This leads to symptoms such as wheezing, coughing, shortness of breath, and chest tightness. Part 2. Causes and triggers. When it comes to the causes of asthma, it's important to note that there isn't a single factor that can be pinpointed as the sole cause. However, researchers believe that asthma is influenced by a combination of genetic and environmental factors. Genetics. Studies have shown that individuals with a family history of asthma are more likely to develop the condition themselves. Certain genes related to the immune system and lung function may play a role in making some people more susceptible to asthma. Environmental factors. Environmental factors can also contribute to the development and triggering of asthma. Let's take a closer look at some common triggers for asthma attacks. Allergens. Allergens are substances that can cause an allergic reaction in some individuals. Common allergens that can trigger asthma symptoms include pollen from trees, grass, and weeds, dust mites, pet dander, mold spores, and certain foods. When a person with asthma comes into contact with these allergens, it can lead to inflammation and constriction of the airways, resulting in asthma symptoms. Respiratory infections. Viral or bacterial respiratory infections, such as the common cold, flu, or bronchitis, can trigger asthma symptoms or worsen existing asthma. The infection causes increased inflammation in the airways, making them more sensitive and prone to narrowing. Air pollution. Exposure to air pollutants, such as vehicle emissions, industrial pollutants, smoke, and particulate matter, can irritate the airways and trigger asthma symptoms. People living in urban areas or near industrial sites may be more susceptible to the effects of air pollution on their asthma. Exercise. Exercise-induced asthma is a condition where physical activity triggers asthma symptoms. The increased breathing during exercise can cause the airways to narrow, leading to coughing, wheezing, and shortness of breath. However, it's important to note that regular exercise is still beneficial for individuals with asthma, and appropriate warm-up techniques and medications can help manage exercise-induced symptoms. Cold air. Breathing in cold air can also cause the airways to narrow, leading to asthma symptoms. This is more common during the winter months or in cold climates. Stress. While stress itself may not directly cause asthma, it can act as a trigger and worsen asthma symptoms in some individuals. Stress can lead to changes in breathing patterns and increased sensitivity of the airways. Medications and food additives. Certain medications, such as non-steroidal anti-inflammatory drugs, NSAIDs, and beta blockers, can trigger asthma symptoms in some individuals. Additionally, certain food additives, such as sulfites used in preserved foods or drinks, can also act as triggers for asthma. It's important for individuals with asthma to identify their specific triggers and take steps to avoid or minimize exposure to them. This can significantly reduce the frequency and severity of asthma symptoms, improving overall quality of life. Consulting with a healthcare professional or an allergist can help identify specific triggers and develop a personalized management plan. Remember, understanding the causes and triggers of asthma is crucial in effectively managing the condition and preventing asthma attacks. Part 3. Symptoms. The symptoms of asthma can vary from person to person and in their severity. Common symptoms include recurring episodes of wheezing, coughing, especially at night or early in the morning, shortness of breath, and a feeling of tightness in the chest. It's important to note that these symptoms may worsen during an asthma attack or when exposed to triggers. Part 4. Diagnosis. If you suspect you have asthma, it's crucial to consult a healthcare professional for a proper diagnosis. They will evaluate your symptoms, medical history, and may perform lung function tests, such as spirometry, to measure how well your lungs are functioning. Remember, self-diagnosis is never recommended, as other conditions can mimic asthma symptoms. Part 5. Management and treatment. While there is no cure for asthma, it can be effectively managed with the right treatment plan. The primary goals of asthma management are to control symptoms, prevent attacks, and maintain normal lung function. Treatment options often include long-term controller medications, such as inhaled corticosteroids, quick relief medications, like bronchodilators, and lifestyle modifications, such as avoiding triggers and maintaining a healthy lifestyle. Part 6. Asthma Action Plan. One essential tool in managing asthma is an asthma action plan. This written document, prepared in consultation with your healthcare provider, provides personalized instructions on medication usage, triggers to avoid, and steps to take during an asthma attack. It is crucial to follow your action plan and regularly review it with your healthcare provider. Part 7. Lifestyle Tips for Asthma Management. Apart from medications, there are several lifestyle tips that can help you manage asthma effectively. These include maintaining a clean indoor environment, using dust-proof covers on pillows and mattresses, avoiding smoking and exposure to secondhand smoke, exercising regularly, under proper guidance, and practicing stress management techniques. Conclusion. And that wraps up our discussion on asthma. Remember, asthma is a chronic condition, but with the right management strategies, it can be well controlled, allowing individuals to lead active and fulfilling lives. If you suspect you have asthma or need guidance on managing the condition, don't hesitate to seek medical advice. Thank you for watching Doc AI, and we'll see you in the next video.